Today's episode is titled Dialysis Demystified. This is an important time of year to focus on prevention and health equity. We're having an open conversation about what dialysis care truly means for patients and families.
That's right, Daniela. Dialysis goes far beyond machines. It's about long-term relationships and supporting patients through a challenging journey. We're excited to show you what it looks like from the inside.
So, Brandon, let's start with you. What led you into healthcare and dialysis administration?
So 16 years ago, I started my career as a dialysis technician. I was working for Long Island College Hospital. I worked for Fresenius. I also worked for DaVita. I was a technician for about approximately 11 years. And seeing the difference that I've made in people's lives, it made me go want to further my career in healthcare. So I went on to be in nursing school, and based on my drive and ambition, um, I was promoted to a facility administrator, in which I've actually had the opportunity of being for my duration of being a nurse as well. So I've been a nursing administrator for about 5 years now.
Okay, my path was a bit different and a bit more unconventional. I was in accounting and management for about 17 years and decided to go to nursing school. I always wanted to be a nurse when I was in my 20s, and I tried twice, got accepted to three nursing programs, but life happened. So I had to go back to school. I was always good in math, so I decided to take an accounting path. So I did that for about 17 years, went back to nursing school and became a nurse. And then I went into the modality of dialysis because I wanted to know my patient on a more one-on-one basis as compared to going into a regular hospital setting.
You know something, Daniela, I think that's amazing. The one thing that I don't think I've ever told you is that I actually started my college career in accounting as well. I actually have my bachelor's in accounting, but I decided to go towards nursing. Look how we ended up in the same place.
I know, we have more in common than we think, right?
Yeah.
Okay.
So for those unfamiliar, what does day-to-day dialysis care look like, Daniela?
So, in-center dialysis is a treatment that filters waste, extra fluids, and toxins from the body when the kidneys can no longer do so. Patients come to the dialysis center several times a week, where a machine gently cleans the blood and returns it to the body. Each treatment lasts a few hours and is supported by a dedicated care team who monitors safety, comfort, and well being. While treatments become a part of a routine, the consistent schedule and familiar staff can often help patients feel supported and cared for. But, Brandon, before we get to dialysis treatments, how do someone become on dialysis? What causes kidney failure?
So Daniela, one thing that the number one cause of kidney failure is diabetes. Um, it has to do with your adrenal glands, just the sugars that you eat, um, carbonates that break down into sugars, where your kidney can no longer process these things. It can no longer regulate the sugar that's in your blood. That's the number one cause. The secondary cause is hypertension and hypotension. We need to make sure that we're watching the sodiums that we take in. We need to make sure that we're visiting our primary care providers at least once or twice a year, just to make sure that all our lab values are within range. Our health is very important. There's no age range that you should get your blood levels checked. We all have to make sure that we're healthy for ourselves and for our families.
And if you haven't done so yet, follow up with your PCP and get those labs done. So this season is all about patient awareness. Brandon, what are the kidney related warning signs that people should not ignore?
So one thing that's very important not to ignore is the fatigue that you feel. If you're overly tired, if you feel like, and I don't just mean tired because you didn't rest. I mean where you feel like you can't function throughout the day, or you can't walk down the block without taking a breath, or you can't catch your breath. You can't perform the activities of daily living on a regular. This is something that's important to get checked out. If you feel any changes due to your heart, or anything in that nature, you need to make sure that you go to your primary care provider to make sure that everything is aligned. anything, symptoms like swelling or fatigue, anything on the legs. If you see that you have swelling, if your socks are a little too tight when you take them off at the end of the night and you realize that there's an indentation on your legs, this is something that can be of concern.
Yes, and it's a sign of fluid overload. So there is a huge connection between heart health and kidney disease. Can you explain that for our viewers?
So heart health and kidney disease are very similar. So for somebody with heart health, the electrolytes that get managed with kidney disease, dialysis is basically your functioning of your kidney once you go into kidney failure. But without that, your pH balance is very important to maintain. One thing that's important is potassium. If your potassium is too high, excuse me, that means that your heart is overworking to try to pump normally. If your potassium is too low, that means your heart is also overworking, which can throw you into muscular dystrophy or heart failure. From a nursing perspective, how does the team manage both, Daniela?
So during each treatment, the care team closely monitors your vital signs such as your blood pressure, your heart rate, and your fluid balance, all of which directly affects the heart. Patients also receive ongoing education about medications, fluid management, diet, and lifestyle choices. All of those support cardiovascular health. Through regular monitoring, guidance, and early interventions, dialysis teams can help reduce the strain on the heart while supporting patients in maintaining the best possible outcomes for their lifestyle.
So, how do you ensure that patients feel safe and respected every time they walk into a facility?
So, compassion, trust, and consistency are the foundation of the dialysis experience. Seeing the same care team on a regular basis creates a sense of safety and familiarity, allowing patients to feel comfortable, respected, and understood. Compassionate care, it builds trust, while consistent routines and relationships provide stability in an otherwise demanding treatment environment. Together, all these elements can help make our patients feel safe in their treatment environment.
We have to realize the impact that we have on patients on a regular. It's already hard enough for patients to come into treatment 3 times a week and to adjust their lives to this new treatment. I remember a time that I started as a new technician. I had a patient that was not even one of my patients directly. And when I say that, I mean one that I was caring for directly. She walked up to me during the holiday season and she said, "Hey, I just want you to know the difference that you make in my life just by doing the things that you do." And for me, that was very purposeful, which was what made me further my career in the medical world.
That's really, really beautiful to hear, especially coming from a patient. So, health equity is a major topic right now. What barriers do our dialysis patients face?
We can have issues with transportation, education, and scheduling. Um, like why is community-based care the answer, Daniela?
So, in dialysis, trust is built over time through familiar faces, honest communication, and consistent care. Being treated close to home strengthens that connection, allowing patients to feel supported by a team that truly knows them and their community. Continuity of care creates comfort and confidence, turning a demanding treatment into a shared journey while patients feel safe, respected, and never alone.
Daniela, we know that it takes a village to raise a child. It also takes a village to raise each other. We all have to look out for each other and make sure that one is safe.
Yes, communication is definitely key because one hand scratches the other. We definitely all have to work together in order to have better patient outcomes. So before we wrap this up, we have some question and answers from our community. So we've been keeping an eye on social media platforms. So we have the top 5 social media questions from Instagram at Healthy Living. My doctor mentioned a renal diet. Is that the same thing as a heart healthy diet, or are there big differences?
Well, a renal diet and a heart healthy diet both focus on supporting overall health, but a renal diet is more specialized. In addition to limiting things like saturated fat and sodium, which also protect the heart, a renal diet carefully manages nutrients such as potassium, phosphorus, protein, and fluids to reduce strain on the kidneys and the heart. Because everyone's labs and treatment plan are different, a renal diet is usually tailored to your specific needs, often with guidance from your dialysis care team or dietitian. From YouTube user Kidney Warrior, I'm worried about the time commitment. Can patients still maintain a social life or travel while on dialysis?
That's a very real concern, and you're not alone in feeling this way, kidney warrior. While dialysis does require a regular time commitment, many patients are still able to enjoy a social life and even travel with some planning. Treatment schedules can often be adjusted, and dialysis can coordinate care if you're traveling. Most importantly, patients find a new rhythm over time, one that allows a space for family, friends, and meaningful moments. Your care team is here to help you, so plan ahead, communicate, so dialysis can fit into your life, not the other way around.
From Instagram at Caregiver Support, what is the best way to help a loved one manage the brain fog or fatigue that sometimes comes after a dialysis session?
Brandon?
Fatigue and brain fog after dialysis are normal. Gentle support, rest, and pacing activities, along with some small routines or shared quiet time, can really help your loved one feel cared for and less overwhelmed. From Facebook, Healthcare Unlocked follower, are there specific exercises that are safe for dialysis patients to help keep their heart strong?
Yes, gentle exercises like walking, stretching, or light resistance work can help keep the heart strong. Your care team can suggest safe routines tailored to your energy and your health. We have a question from YouTube user NewPath26. What should I look for in a dialysis center to ensure I'm getting equitable care, that my voice is being heard?
Well, looking for a center where staff listen to your concerns, involve you in care decisions, and treat every patient with respect and autonomy. That's what's most important. Equitable care means that everyone gets the same attention, resources, and support, no matter the background or circumstance. You can also ask about patient feedback processes, staff diversity, and how they address concerns. These are all signs that your voice truly matters. It also helps when you have a multi-care facility like Doral, the company that we work for, that offer adult daycare services. They offer primary care provider services. Everything within one building that a patient can go and handle all their appointments at one time.
So those are excellent questions. It shows how much our community wants to stay empowered. Brandon, to close us out, what is one bit of wisdom you want to leave with our viewers?
Well, my wisdom is this: be your own best advocate. Don't be afraid to ask why during your treatment. Your care team is there to work with you and not just on you.
Okay. And mine is focus on the small wins. Whether it's hitting your fluid goal for the day or feeling energized enough for a walk, celebrate it. This journey is a marathon and every step counts.
We want to thank you for watching Healthcare Unlocked.
And remember to like, follow, and share this episode. Subscribe to us on YouTube and follow at Healthcare Unlock on Instagram so you never miss an update. We'll see you next time.